Genetic disorders, aneuploidies, abnormal number of chromosomes, trisomies, presence of three chromosomes in place of a pair, Down syndrome, trisomy 21, most common trisomy. Most common trisomy is Down syndrome. Pathogenesis, trisomy 21, 95%. Translocation, 4%. Mosaic, 1%. Trisomy 21, maternal meiotic non-disjunction, non-separation of chromosome during meiosis, most common genetic cause for Downs. Translocation, T1421 and T2121. Third, abnormal pair of chromosome 21 with three others. Chromosomal abnormalities found in Down syndrome. Clinical features, facial abnormalities, face and skull. Brush-filled spots in eyes, upslanting palpable fissures, mongoloid slant of eye, apicanthal fold, open mouth with protruding tongue due to hypoplastic mandible. Brachycephaly, flat occiput, redundant skin. Low set ears, flat nose, flat face. Limb abnormalities, palms, simian crease. Single transverse palmar crease. Fifth, little finger, clinodactyly, curved finger due to hypoplasia of phalanx. Foot, sandal gap, increased gap between first and second toe. Internal manifestation, heart, congenital heart defect, most common in 40%. Endocardial cushion, enteroventricular septal defect, most common cause of morbidity and mortality. Brain, low IQ and hypotonia. GI defects, intestinal atresia, most common seen in duodenum, intestinal obstructions. Others, Hirschsprung disease, aganglionosis, annular pancreas. Other associations, hypothyroidism, congenital or acquired. Autoantibodies found in older children. For example, antithyroid peroxidase antibodies. Leukemia, acute lymphoid leukemia, most common overall. Acute myeloid leukemia, M7, megakaryoblast, most common in less than 3 years of age. Presenile Alzheimer's disease, 35 to 40 years of age. Trisomy 21, overexpression of amyloid precursor protein APP gene. Amyloid increase deposited in the brain, presenile Alzheimer's. Atlantoaxial subluxation instability, 10 to 13%, upon hyperflexion during sports. Sudden compression of spinal cord. Diagnosis, lateral x-ray of neck. Advice, avoid contact sports. Recurrence risk, general 1%, maternal age more than 35% up to 4%, parents with Robertsonian translocation. Translocation T1421 in 10% mothers and 5% father. Trisomy 2121 will be 100% if present in mother and 100% in father. Edwards syndrome trisomy 18. Second most common trisomy is Edwards syndrome trisomy 18. Microphthalmos, short palpebral fissures, short neck, limited hip abduction, dorsiflex toe, prominent heels. Occiput or back part of skull is prominent. Dysplastic or malformed ears, clenched hands with overlapping fingers. Internal manifestation, cardiac heart disease more than 90%. Ventral septal defect is more than, patent ductus arteriosus is more than, AST. Renal horseshoe kidney. Pato syndrome, trisomy 13. Scalp defects in some places, aplasia cutis, microphthalmos, cleft lip or palate, absent or missing ribs, undescended testis, cryptorchidism, male child, clenched hands or polydactyly or extra fingers, post-axial polydactyly, dysplastic or malformed ears. This is all in Patu syndrome. Heart defects present in 80 to 90%. Most common is again ventral septal defect. It's more common than patent ductus arteriosus is more common in AST in Patu syndrome. In CNS you can see holoprosencephaly in CNS. Turner syndrome, karyotype 45. Exomonosomy 57%. Exomonosomy X 57% is more than mosaicism 29%. Partial monosomy 14%. Monosomy in some cells. Ring isochromosome X. Gender female. Clinical aspects, and we are talking about Peto syndrome trisomy 13. What are the clinical aspects? Manifestation: short stature, adults less than 145 centimeter, neck, web neck, loose skin folds. Lymphedema may involve foot, hand, neck, cystic hygroma seen during infancy. Cubitus valgus, carrying angle more than 135%, increased lateral deviation of limbs at the level of the elbow. Patu syndrome, normal IQ, low hairline, shield shaped thorax, widely shaped nipples, shortened metacarpal, intravenous, small fingernails, streak ovaries, folds of skin on the neck. Internal manifestations: heart, bicuspid aortic wall, coarctation of aorta, kidney 50% horseshoe kidney, delayed puberty and infertility in adulthood, pseudo tumor syndrome, Noonan syndrome. Inheritance, autosomal dominant, males and females can be affected. Gene defect, PTPN, protein tyrosine phosphatase non-receptor gene located on chromosome 12q24. Protein tyrosine phosphatase non-receptor, PTPN, gene defect. Gender Turner is seen in females. Noonan can be seen in both genders. In Turner's, IQ is normal. Gonads are present as streak ovary. Most common heart defect is bicuspid aortic wall or coarctation of aorta in Turner's. So Turner's happens in females. There is normal IQ. There are streak ovaries, and most common heart defect is bicuspid aortic wall and coarctation of aorta. Noonan can happen in both genders. IQ is low. They can have cryptorchidism in male, and the most common defect is pulmonary stenosis. So Noonan can happen in both gender. IQ is low. Cryptorchidism can happen in male, and pulmonary stenosis is also a defect. Klinefelter's syndrome. Increase aromatase enzyme testosterone to estrogen. Situation of breast tissue, persistent increased risk of breast carcinoma. Long-term complication, increased risk of extragonadal germ cells tumors in anterior mediastinum. Tall stature, long limbs, reduced facial hair, reduced axillary hair, breast development, gynecomastia. Cryptorchidism, decreased testosterone, delayed progression of puberty. And reduced facial hair and reduced axillary hair is seen in eunuchoid body habitus. Microdeletion syndromes, deletion of a tiny part of chromosome undetectable on karyotyping. Deletion of a tiny part of chromosome which goes undetectable on karyotyping, that is microdeletion syndromes. First is DiGeorge syndrome. Affected chromosome is 22q11.2. Defective development of third and fourth pharyngeal pouches. DiGeorge syndrome. Defects in thymus and parathyroid. Second is Williams syndrome. Deletion is in 7q11 and 23. Clinical features. And we are learning the clinical features of DiGeorge syndrome. So, DiGeorge syndrome has thin upper limb, small jaw, hypertelorism, widely separated eyes, low lying notched ears. Association is catch 22. What is that? C is for cardiac conotruncal defects, tetralogy of Fallot, most common. A is for abnormal face. T is for T cell deficiency due to absence of thymus. C is for cleft lip or palate. H is for hypocalcemia due to parathormone deficiency. 22 is for chromosome 22. That is catch 22. Clinical features of Williams syndrome. Prominent forehead, puffiness of eyes and cheeks, wide mouth, elfin face, association hypercalcemia, heart defect, supravalvular aortic stenosis, most common, low IQ, learning disabilities. What are the association in Williams syndrome? Prominent forehead, puffiness of eyes and cheeks, wide mouth, associated with hypercalcemia, heart defect like supravalvular aortic stenosis, low IQ, learning disabilities. Pathology. One gene has two alleles, active and inactive. Active, genomic imprinting disorder, deletion. Inactive, disomy. Prader-Willi syndrome, genetic defect, chromosome 15q11 to 13, deletion of paternal allele and disomy of maternal allele. Clinical features: massive obesity, Prader-Willi syndrome, increased ghrelin, increased appetite, increased food intake, short stature compared to children of similar age, third, small hands and feet, 4, small eyes, almond shaped eyes, 5, hypogonadism, delayed puberty, low IQ. Angelman syndrome, also known as happy puppet syndrome. Gene defect 15q11 to 13. 15q11 to 13, deletion of maternal allele and disomy of paternal allele. Clinical features, neurological features, increased incidence of seizures, hypotonia, low IQ, speech defects, communication in sign language, abnormal movements of hands and feet, ataxia. Trinucleotide repeat disorders. Trinucleotide repeat disorders. Fragile X syndrome. CGG repeats. Less than 55 is normal, more than 200 is trinucleotide repeat disorder, CGG. Fragile X syndrome. Less than 55 is normal, more than 200 is trinucleotide repeat disorders. Gene defect, fMRI, fragile messenger ribonucleoprotein protein gene. Fragile messenger ribonucleoprotein protein gene. Clinical features: large ears, long face, prominent chin. Macroorchidism, large testes post puberty, increased behavioral abnormalities, ADHD, attention deficit hyperactive disorder, and autism. Other associations, connective tissue defects like hyperextensive joints, high arched palate, mitral wall prolapse, low IQ. We'll continue with childhood infections in the next video.